Fasana?
Yeah.
Yes,
Good
starts.
morning, team. Shall we start?
Yes.
Okay. Kirti, you can go ahead.
Thank you, Fazana. Good morning, team. Uh, am I audible to all of you, team?
Yes, Kirti. So audible.
Yeah. Uh, okay. I think Santhya, Vignesh, Kishore, Vishal. So, who all are going to train in home health? Please confirm me. Is my voice audible?
Yes, audible.
Yeah.
Yes, ma'am.
Thank you. Okay. So, let me share my screen. So, just confirm me. My screen is visible or not.
Yeah, it's
Yes,
visible.
Kirti, it's possible.
Yes, ma'am. Yes.
Yeah. Thank you so much, team. Uh, and team, firstly, all of you, all the best. You opted a good, a good department, which is home health, and in coming upcoming days, it is going to boom like anything. And this is a very very good platform that we could earn a better, and we can grow in a career in a better way. So, anyone having any idea about home health, or if you could hear from your friends as well? Anyone having any idea, a little idea? Anyone? I hope so. Okay, team. Let me introduce. Firstly, my name is Punyakiti Devraj. Okay, so I'm having a 8 years of experience in home health, and I do given two batches with home health. And here I'm going to give a complete three levels in home health and how it would be, and how it going to work on. So the home health is nothing but the skilled professional care who is going to take care of patients at their own homes. It means the patient who are not able to take care of himself or herself due to a chronic ill conditions or any after surgery, they will mostly prefer a home health because of the cost effective, and they can stay at home, which is comfort and with the family support, and they have so many of therapy services and skill nursing, and they came home and they do the whatever the care the patient needed. And the one-on-one care is mostly effective for the patient, which is a personalized intention, and they could also have the lower hospital readmissions. If the patient are going to take care through the home, they will have these type of benefits, and they don't want to go to the hospital again and again, and they don't want to go into the mental trauma. Some of the people may have a fear to be in the hospitalized, and so that the our US people are looking for the home health which they can take care from their home itself. So we are having the age criteria, and so from the pediatric to up to 65 plus years. Okay, so here there are no any age criteria we are applying here, and there are no like female male. It's not like that. Whoever the patient it is, and whatever the age it is, based upon their conditions, they could choose home health due to their cost effective and the independence, and to improve their home health. And for the older adults who are the 65 plus years, mostly these peoples can choose the CMS based upon the CMS guidelines, the eligibility criteria of medical facility. These people mostly affected with stroke, heart failure, COPD, diabetes, falls, or any replacements, or any wound care. For these patients who are not able to go to the hospital frequently, so they can choose the home health. Home health is nothing but the patient could take care their complete functional abilities from the one of the caregiver. Okay, may it could be a family member, may it could be a skill nurse or any PT or any OT, ST and all. Okay. So based upon that, based upon the physician orders, they could able to choose the home health. And for the adults also from 18 to 64 years, here the adults who like us. So those are the people like of any C-sections happen and the patient not even to take care or not even to take care by her own self, they could opt the home health for sure for the surgery recoveries or any fractures, any IV therapy, wound care, or any chronic disease management. And for the pediatric patients who are the infants or babies or uh, not going to be not in to be the hospital, so the parent and the pediatric baby will opt the home health to take all the NICU treatments also in a home itself with the cost effective. Okay, so these are the facilities will be given through the home health. And we have some multidisciplinary actions in the home health, which is registered nurse, physical therapist, occupational therapist, speech therapist, medical social worker, and HHA. And each of the specialty, each of the discipline having different assessments and different field of strength that could able to give the patients. For example, for registered nurse, she or he, whoever the nurse is there, going to take care of this role: assessment, wound care, medication management, and education. And the PT, physical therapist, to give improved strength, mobility, and balance. For the PT, I'll give one example, like if patient is having any replacement, knee or shoulder, whatever the replacement or fractures are there, mostly the PT will come and do the treatment, or they will give treatment is nothing but outer external treatment they will give, like exercises, or to teach how to go with the physical therapy, physiotherapy, and all will give by the physical therapist. So for the occupational therapist, how they can able to do the bathing, dressing, cooking, the daily activities, how they want to do when they have any surgeries or any stroke related conditions like that. And for the speech therapy, mostly if you see the patients who are having stroke with hemiplegia and they couldn't able to speak properly, like speech deficits will be there, dysarthria, aphasia. So for those type of patients, speech therapy will be allocated. And medical social worker, HHA, these are not an important part, but we can give a simple idea. And most probably in home health, the above RN, PT, OT, ST will play a major role. Sometimes respiratory therapist, RT will be coming. That wouldn't be a major part. That will also we will uh, consider in a further sessions. Okay, so these are the main disciplinary teams that we are going to observe. And the next important part in the home health, we have four types of oasis: SOC, ROC, recertification, and discharge from agency. So SOC is nothing but start of care and the first visit after the physician's order. It means if we are going to the hospital for the first time for any of the condition, that should be considered as SOC, that is start of care. And the resumption of care after the start of care within 48 hours or the next time that we are going to the hospital with the existing conditions and the new condition. For suppose the patient is admitted for the first time due to the hypertension, but the in ROC, the patient is diagnosed with diabetes and they wants to go to the hospitalization. The second time, if the same patient coming to the hospital for the existing conditions and for the new condition, then it should be considered as resumption of care. The new condition which is evolved in the next time, the subsequent visit, it should be considered as ROC. And the recertification is nothing but it should be considered every 60 days. So as per the CMI's guidelines, uh, we would calculate in the two sections, 30 and 30 period. Okay. So the in the recertification, mostly if the patient coming for the existing conditions with the care, for suppose the patient coming for hypertension only and he is ongoing with the continuing care for that hypertension, that should be considered as recertification. And the finally, if all the SOC ROC recertification is completed and the patient is now completely independent and he cured, he is completely stable on the chronic conditions and where the acute conditions are resolved, then the patient finally go with the discharge. So this is how the oasis types will be there in home health. So we are having the other areas also. In the further sessions, we could cover that as well, but these are the important things. And mainly the patient who are coming for the start of care and resumption of care, recertification, no need to worry. The project itself could able to give us this patient has coming for the recertification. Based upon that, we can go through directly. Okay. So no need to review whole the chart and no need to conclude this is the recertification. From the client side itself, they would tell us this is the recertification, this is the ROC, this is the SOC case. Okay. So no need to worry about that. And these are the types of oasis: level 1, level 2, and level 3. In level 1, only we will go with the ICD-10 coding. There would be not having any CPT or no need to give any CPT codes and all, any HCPCS, no need to give HCPCS, no need to give CPT. Only the pure ICD-10 will be there in level 1. And level 2, with coding only, we include oasis. So oasis, I'll tell you in the next slide. And level 3, with coding only oasis, we would have POC. Okay. So firstly, I'll tell you a basic idea on ICD. ICD is nothing but that we all know what is ICD. Correct. So here the pure ICD will be there, but in home health, we do follow some criteria: primary diagnosis, secondary diagnosis, comorbidities, etiology and manifestation, and code sequencing. These should be our main part in the home health. So firstly, the patient why are going to the hospital and what is the main reason, that should be our primary diagnosis. Primary diagnosis is main thing in home health. That would be an PDGM hierarchy level, and it should be caused to the client to insurance very effectively. Okay. So primary diagnosis is must and should in home health. And the secondary diagnosis, the condition which are not admitted. Okay. If the patient admitted for the hypertension, also the patient is having diabetes or any hyperlipidemia or any other chronic conditions like COPD, that should be sequenced in secondary position. Okay. The remaining things which are comorbidities like stroke level hemiplegia or any hyperlipidemia or any vitamin D deficiency, and the conditions which are going to support with the medications, those should be given in the comorbidity list. And the etiology and manifestation. Etiology and the manifestation, like if the patient is having some disease or with the underlying cause. First, suppose if patient is, give me a couple of minutes. Huh? I'm sorry. I'm sorry for the disturbance. And yeah, etiology and manifestation. First, suppose if patient is having any adverse effect due to some of the, for example, we can go with chemo related. So if patient is having cancer and the patient is having adverse effects due to some of the chemotherapy drugs, so those will come under etiology and manifestation codes, and the most probably code sequencing. Code sequencing is nothing but the above listed points: primary diagnosis, secondary diagnosis, comorbidities, and etiology and manifestation. No need to worry. We are here to help you how to sequence. Okay. So this is very, very easy part, and we can easily give the sequencing in a proper way. Okay. But the main thing is, for what reason the patient is coming for the clinician office. So that is the main reason we have to review and we have to pick the primary diagnosis. This is the more crucial point in home health. This is what ICD-10 coding and the OASIS. So this is the OASIS. Basically, what is meant by OASIS means outcome assessment information set. Okay. So here we have different areas from A to O. OASIS is completely nothing but how the patient is doing with complete functional activities from the top to bottom, like how he is moving, how he is eating, and how he is going to do the daily activities: bathing, grooming, like upper body dressing, lower body dressing, okay, toilet transfer. Each and everything will be included in the home health. The patient details, date of birth, and how the racism will be, each and everything will be included in the OASIS part. And the most important thing here is we have some sections, like if you see here in a part, oh, I'm sorry. If you see here in the patient identification A part, from A0010 to A2400, which is demographics. The same thing, like we have a functional limitations and musculoskeletal elimination for each and every anatomical locator, we have items. So based upon that, we need to give a response. Okay. I'll give a simple example. If patient is not able to do the upper body dressing and the caregiver coming for to assist and to complete this activity, it means the caregiver helping to dress the patient, upper body dress to the patient. For that particular activity, we have one M item, that is M1810. Okay. So like that, each and every activity we have an functional items. So based upon the patient's response and based upon the clinician's response, we are going to give. And here also no need to worry about that. Already the patient get interviewed by the particular clinician and they will fill it out. Our job is to do whether the clinician given correctly or not. Okay. For sometimes what happens, the patient will be the dependent due to the bed first, but the clinician on a hurry, or if she or he doesn't taken a proper interview, and they will give it as patient independent. That is not a proper. Okay. At the time, what we will do, patient is completely bed fast and he's not able to do the activity completely, means we need to give that response as dependent. Okay. So that is why how to correct from our end. Okay. We are just here to correct the responses, whatever the clinician did from their end. That is what the OASIS part. Okay. And come to the POC. And the POC is nothing but plan of care. If based upon the conditions, we are giving the care, a plan of care to the patient, how to do the uh, how to do care that particular diagnosis. For example, I'll take a diabetes. Patient is diagnosed with diabetes. For the diabetes, we have one M item, that is M1028. Okay. So clinician marked none of the above and we are going to mark diabetes. Okay. For that diabetes, we need to give plan of care. How to manage that diabetes through the medication, through the diet control, and through the monitoring of blood glucose levels. So these are the things we need to give. Basically this is the clinician's part. So clinician needs to give this complete section very clearly. If the clinician missed out anything, then we need to suggest to the client that patient is having diabetes and clinician uh, forget to give this. So we please suggest that patient need to take care of this and these things for related to the diabetes. So this is what we need to do in a plan of care. Okay, up to here, any doubts, team? Okay, thank you. So I'll go to the a simple example how it would be. Okay. So Mr. John, 68 years old, was discharged from the hospital after treatment for a diabetic PVD. So the patient was discharged completely from the hospital, but the reason he came for the hospital for the treatment is diabetic PVD, which is considered as primary diagnosis, and he has some of the additional diagnoses like high blood pressure and hyperlipidemia. So I am giving in a 3 steps: ICD-10, OASIS, and POC, how it would be for your clearance. Okay, in the step 1, the coding part, the primary reason is for the patient coming for the hospital for the treatment is diabetic PVD. So I have given with the case mix code E1151. Okay. And the patient is having some chronic and comorbid conditions, hypertension and hyperlipidemia. So hypertension, I given it as secondary, and comorbid conditions I given followed by the secondary diagnosis. This is how the sequencing will be there. And in home health, we do apply aftercare codes, medication codes, also the status codes and the history codes. Okay, this will, I'll tell you a complete information in a further sessions. This is only for your clearance. Okay, and how this diabetic PVD will applies in our OASIS. So this is how OASIS looks like. So if you see here, active diagnosis, comorbidities and coexisting conditions. This is the M1028. Wherever you go, home health OASIS will be the same. Okay. But the application of our review part is based upon your documentation only. Okay. Here we have a direct question for that OASIS, diabetes and PVD. M1028, and they have given a check boxes. Okay, if patient is having DM and PVD, we need to click on the response 1 and 2 for sure. Okay, and if patient not having diabetes and PVD and the clinician marked response 1 or 2, we need to give response 3, none of the above. Okay, this one we need to select. So now the patient is having diabetes PVD as per my example. So I have given this response 1 and 2. Patient is having diabetes mellitus and patient is having PVD. If only patient is having diabetes mellitus and no PVD is there, no need to mark response 1. Only you need to mark response 2. And here the case mix codes will be applied. Okay. Don't worry about that. If patient is having other than PVD, like diabetes with cataract, diabetes with CKD, diabetes with retinopathy, whatever the case mix codes will be available, if the patient is confirmed with diabetes, we need to give a response to. Okay. It is not like completely the patient is having DM PVD. It is not that item. Patient is having DM or not, PVD or not. That is what it will works out. Okay, so this is how we will give the response in our OASIS. Next, how it would be impact on our plan of care. So for each and every active condition, each and every active diagnosis, we need to give a skilled care precautions to the patient if the clinician has missed out. Okay, so if, for suppose, if clinician missed out all of the diagnosis, we have a particular set of goals and interventions to that particular diagnosis. We can select and we need to give. Okay, each and everything will be packed up in your project only. Just we need to check it out and we need to pick it out and we need to suggest. That's it. Not nothing more than that. We are not going to scribe anything. We are not going to enter from our end anything. Okay, that's we need to review and we need to select the proper response and we need to give them. Okay, already clinician did each and everything from their end only. We are doing our part is just to review whether that clinician response is correct or not. If it is wrong, we need to correct it. Okay. So for the diabetes, if clinician missed to give any monitoring or any diabetic education, this is the basic thing that we need to give. So patient needs to continue monitoring with blood sugar levels and diabetic education, dietary with medications. Okay. The same thing applies to PVD and hypertension as well. This is how the diagnosis will impact on OASIS and POC. And these all three will work together like this. Once all three will work together, finally the patient will recover safely at home and he or she can improve their mental health and he can prevent the hospital readmissions and also they can early detectify the complications as well if the patient is opting home health. So we the patient is having the facility like they can early detect the complications based upon their conditions. For that also they can take a treatment in the home itself without going to the hospital. Okay, so this is what the main goal. And we do have some EMRs which are mainly related to the home health. Okay, HCHB, which is home care, home base, Kinser, and Access. I'll give a navigation part on these platforms. Okay, because when you're going to interview any of the home health uh, interview, they will definitely ask whatever the platforms that you do hands on. Okay, so these mainly HHB, Kinser, and Access are going to playing a major role in each and every organization. If you take Omega, Red Road, in Red Road it is HCHB more important. Omega it is having HCHB and Kingser. And if you go to the Mega Genesis, HCHB, Kingser, Access. In Mega Genesis, all these platforms will be workable. But mostly these three platforms are enough to give in an interview section. I'll give a navigation on that. Okay, and remaining platforms, once you go into the production floor, they'll give you a shadow session or they'll give you a training purpose on that particular thing. But at least you need to have a minimal idea on HCHB, Kinser, and Access. Okay, so and we do have several companies like Mega Genesis, Omega, Augustus, next Global Health, and also Foresight Company, Infinix, and these are the some companies. And nowadays, so many companies are going to start up with home health because of this booming. Um, we can have a lot of opportunities to go in home health. Okay, once you are hands on this home health, you will be a pro and get a good income on this. That's what I could say. And the certifications like in home health, basically we can hear only the AAPC and IHIMA. But in home health, we have a special certifications. If you want, you can do it from your end. That is BCHHC, COSC, HCSO, and COQS. These all four together related to the only completely based upon OASIS, in deep OASIS. Whatever the clinician will do in the OASIS part, that level of examination will be there. Okay, so these four certifications, no any organization will be provided. You only have to take care it of and you only have to do it from yourself. This is a completely optional. whether you can do it or not do it. Okay, but some of the organizations will ask BCHHC for a toughest projects like FASI project. FASI project is one of the toughest project nowadays, and the client is very sensitive. And for that project, they needs BCHHC at least for sure, because the OASIS part will included in depth in BCHHC certification. I think Omega is providing this BCHHC. Remaining any of the organizations are providing this BCHHC. Okay, if you want, you can do it from your end as well. Okay, and these four are main certifications that you wanna do means you can. But if you have any CPC, CIC through AAPC, these two certifications can carried out in any of the organization. Okay, because these two things will be related to the complete ICD-10, but not included any OASIS. But however, CPC is the one of the precious certification that can concluded in the home health. And CIC, CCS, this one also they can include. But if you have CPC or BCHHC or any COSHCS, that would be very beneficial to join in a home health in a earlier base. This is what is home health and what are the certifications and what are the EMRs and whatever the organizations that now are going ongoing with the home health projects. Okay, I don't want to confuse with the agencies with you people, because they will ask in an interview based only the EMRs. Okay, but I'll give with one or two agencies with each and every EMR. Agencies are nothing but project related. Okay, so this is what home health. Anyone having any questions from your end? Feel free to ask me. I'm there here to help you and to give each and every answer for your doubts. Team, or everyone understand what is home health? Fazana, over to you. That's it from my end.
Yeah, Kirti. Uh, so do anyone having any concerns or query related to home health?
Hi, I'm Adam.
Lilu, you're
Yes,
audible.
I am Leela Kumari.
Yeah.
What is the training, if it is a home health, any training, if freshers means it is okay. For experienced people, how it will work? Because my friends or so many people are taking that IPDRG training. In the training period, they said we will give the placements and we will give the 100% placement assistance and some backdoors also. Now, after the training, they are keep quiet. They are not telling anything. After we will give individually for the interview also. How will they consider? They consider the experience and how we have to keep that. If any experience is there in the particular IPDRG or home health HCC, they will ask the experience. No, if we will do the training, please give me the job. Means no one is not giving. How do we get the job? Mainly, we have concern with the job only, right? Training, who everyone will do the training. It is not a problem. Main concern is the placement. They will take. They are not taking nowadays. So, you have any idea about this? Means you can.
Yeah, thank you, Lilu. Thank you for your good question. See, Lilu, some of the members like we have a career gap means it is impossible to get a job through the back door. So I don't want to give a fake promises that we will give you 100 placement job after training. Okay, so we are looking for the vendor. Okay, once the vendor is okay with us, we are going to take you people in this organization itself. Okay, I'll give hands on each and everything on a chart basis. Okay, And if you want to go to any other company and I have a circle, so I'll tell them that this is a fresher and she got a cross training, and she will do a she will do good in your purpose also, because we have a startup companies and who do started uh, my friends only. So I can give that much of promise to you, like not a complete placements, that I can give you a promise. I'll put you in my friend's company itself if you're good with each and every part, like in a level 3 part if you're good with. So I'll definitely suggest you. Even Farzana and Chandru also working on that only. So we don't want to lose any of the trainees who are good at in home health subject. So we are going to take vendor from our end only, and we will took, if the vendor is completely okay with us, it means it is worked out, you can easily get a job here itself. Okay, it is not like that, Lilu. If see, training is like just to give an idea on that particular subject. Okay, it's up to you whether you need to keep a fake experience and all. But I would tell you, in home health, it wouldn't be worked out, because in coding, each and every day there will be a target. Okay, your target, you have to finish it up. And for home health, if we take a back end support also, it won't be worked out, because it is very highly impossible. So we need to make a arrange a team, and we need to see several things will be there. Okay, so for one or two people, if we take a back end, the carry will be goes down to that particular person. Okay, Lilu, got it my point? If you are okay with cross training and all, and if you are okay with complete knowledge, okay, they will happily select you. Any organization you can go, but I won't suggest you that you need to give a 5 years 6 years experience. I hope so 1.5 to 2 years is more than enough. Okay, then they will pick you for sure, because you have a great knowledge in home health. So then that is okay. But some people, how they will consider, okay, in IP I do have 6 years of experience, now I want to jump in a newer environment, so they will took a cross training in home health and they will apply the all 6 years in a home health also. That wouldn't be possible now. Even though from home health too, if any of the people going to get any of the job or any of the IT, so that won't works out. It would be definitely considered as fresher only. So instead of fresher, we could have to say 1.5 to 2 years experience. That is more than enough. Okay, Lilu, Lina,
Yes,
yeah.
yes, yes, yes. Yes, it is good, but they will take if we are doing a cross training. We will take means they will take.
Cross training, yes. See, you doesn't want to tell that cross training. Okay, you have to tell that I do have 1.5 year to 2 years experience. That is more than enough. In cross training, you will give you will provide with a practice charts also. Okay, if you have already the idea on ICD-10, let me know you have any idea on ICD-10.
Yes, Kirti, I have actually seven years experience in the coding. In that 3.8 is ED, and rest of this I am a HCC coder.
Okay, HCC is a good one. So for HCC coders, who are HCC coders here, they will have a good opportunity to go into the home health, because some of the organizations, if they have a higher amount of recruitment, okay, in a bulk amount of recruitment, they will easily select the HCC people based upon the ICD coding, because in home health we have level 1 coding. In level 1 coding, only the ICD-10 will be there. I'll tell you one example. In HCC, we do encounter each and every dose. Correct. And we are not going to code any acute conditions without any active support. But in home health, we do code all the conditions. Okay. Chronic acute conditions also we do code. But like any sepsis or any infections are there, we need some support. For that only we are deleted that codes. Okay. Based upon that only we will code ICD-10 with primary, secondary. So what is that? Comorbidities. So this sequence will be there. That's it. For HCC coders need to learn OASIS and POC and ICD-10 sequencing rule. Okay. So no need to worry about that, Lilu. So you can tell that I do have a HCC experience above around 5 years, but I recently shifted to the home health, and you can tell any of the startup company. Okay. I'll help you on that. Okay. If they did any background verification, if you tell any of the startup company, then that will box out. No worries. If you tell like I did some freelancing in a home health, so I do have 1 year of experience in home health, but I'm not sure how much they will pay you. Okay. If you have 50,000, maybe because of this one reason they would reduce your in your salary basic. I don't want to discuss about those things, because I won't give that promise, because I'm not running any of the organization and I'm not going through into that organization, right? So that is completely their rules, Leelavati. Okay, so no issues. Any of the HCC coders or any of the other department coders also, you can tell like I did 6 months of freelancing and 6 months in other organization, and I do have level 1 and level 2. Okay, level 3, I could tell you based upon the project level, it would be changed. But I'll tell you overall review, what it would be and how it would be. So you can tell them, I have a basic idea on a level 3, but I do have experience in level 1 and level 2. Up to that, I'll give you a promise. Okay. That is the main thing. Any other concerns?
Okay, thank you, teacher.
Yeah. And again, I'm telling you, team, we are not here to give any back-end support. Okay. Whatever the training session is going through, in that training session only, you need to learn each and everything. If you're from the ICD-10 background, you're having the only uh, two things you need to learn, OASIS and POC. Okay. So mainly the OASIS plays a major important role than POC. Okay. And in ICD, just we need to take a sequencing rule. And the primary diagnosis, which we need to pick it off. Okay. In interview, they will give some basic questions, how to pick a primary diagnosis. I'll give idea on that as well. Okay. It is very easy, not a bigger issue. That's why I'm telling you, don't tell more than 2 years of experience. I would suggest only 1 to 2 years is more than enough. A complete home health one. If they need a highest recruitment, they will definitely took you in the production level. And even though they'll give 45 days, each and every home health organization, they will give firstly 45 days of training session on the project level basis. Okay. So this training and that training will be help you a lot to get into your home health. And most probably nowadays the home health projects are completely work from home. That is one of the biggest opportunity for us, especially for women category. And I'll tell you another thing, how it would be the target. Okay. For the level 1, the coding only, we need to do 18 chats per day. Okay. Complete coding only 18, 18 charts per day. Coding only was 12 charts per day. Some organization will be 11, some organization will be 12. 11 or 12. Okay. And the complete coding versus POC is from 5 to 7. Okay. Based upon the agency updates, based upon the agency timing levels, we need to do daily 5 to 7 charts. I hope only 5 to 6 charts only. 7 charts is more than a target. If some like Augustus like company, they will do 7 charts per day. And Omega like company, they will do 6 charts, and mine as well, 6 charts will do. And Clinicon like Clinicon like in that companies, they will do just 5 charts, but with a highest more updates. So they will have agency updates in a higher number from the client side itself. So based upon the updates, based upon the timing levels, based upon the EMR updation, the target will be there. Okay, this is what hold the target. Okay, so any other concerns related home health? I think everything is clear. If you have any concerns since on, please let me know. See, guys, if you have any concerns, please speak it up. Then only I can give a good idea on that. Okay. So further on, the sessions will move a smoother. So please be interactive. It is your session, guys. You are going to take a home health training without any doubts. It won't be works out. I know home health will rise up n number of questions. Anyone? No.
Hello.
Yeah, Sushma.
Yeah. What will be the duration of the training?
Yeah, thank you. Thank you to remember me. So this is around 30 to 35 days. And once everything is goes good, from next week onwards, we will go to the continuous sessions. Okay. We will let you know the exact date when we are going to give. And also every day there will be an 1 hour session, and Saturday, Sunday, uh, um, these 2 days. Okay, you can take whatever the day you want. Okay, I'll give on Saturday, Sunday a practice charts with examples. Okay, you can send it on the same day as well, or else in Monday I'll share you with complete feedback on Monday. You can take 2 days, Saturday or Sunday, but make sure you have to do it. Don't take any other support, then only you will get hands on this home health. Okay, so
Yeah.
complete duration period is 30 to 35 days, and every day 1 hour session.
So the class timing will be in the evening, right?
Yes,
Because
in the evening.
as I'm working right now, so
No worries, Sushma.
yeah.
The sessions will be at evening only. We will let
Okay.
you know the timings and the exact date.
Okay. And what about the fee structures?
So that will Fazana to care it off. Okay,
Okay.
you can
Okay.
talk with her. Okay.
So my concern is I am currently doing HCC coding.
Okay.
Okay. So my concern is my office is in Bangalore,
Okay.
and I'm settled in Mumbai. So before they had given work from home, but now they have started hybrid. Okay.
Okay.
So my main motto is I wanted either in Navi Mumbai, like in Mumbai location, going to office is not a problem. But if it is, because as now I am searching for a job, mostly the opening is in the southern part of India. So
Yes.
they are asking for either for relocation or either they are not giving work from home. So I am wondering whether this home health will be helpful for me to find a job in Mumbai, or as you told me that there are work from home options are already there. So if in case there are companies in Mumbai, they have opening in Mumbai, do you have any idea about that?
Yes, yes, Sushma. So there is a one company from Noida, I think, Gibbs Healthcare. I think so many of you will heard about that company. So recently, I think Gibbs company is managing with the Fuzzy project, but that Fuzzy project, unfortunately, due to some quality issues, it went to the Omega. So the home health is not working smooth in Mumbai area. Okay, but you do get the jobs like work from home from the Pune locations. You have a number of companies, I think 3 to 4 number of companies in Pune location. So those are giving the work from home, also work from office. If you want to relocate to Pune, that is well and good. If you don't want, you can have an opportunity to do work from home.
So
Okay.
the so if a company hires, they have their own level of training according to the projects they have. So the company training will vary from time to time, like depending on the this thing, what you say, uh, uh, projects and how they are
Yeah.
conducting the training. So it
Yes.
will not be work from home from day one. Obviously, I have to go and attend for at least 30 to 40 days as a training, right? So
Not all the companies, Sushma.
okay.
Only some of the companies. If you take LKN or any Clinicon, now they started hiring. Okay. If they have a bulk recruitment, they will
Hmm.
definitely choose you as a work from home option only, because they are basically the Pune locator peoples. What they will think, they will mostly prefer the North Indians to give
Okay.
work from home, because they will have a good transfer facility and nearby. Okay.
Okay.
And South Indian people, if they want to go to the Pune location, it is a longer distance. Like, if you go into the train like that, it will take 2 days,
Ah,
obviously.
yes. Yes, yes,
So
yes.
they are looking like people from North India for some days, from sometimes over all the India, whatever the location it has. But
Okay.
mainly, I'll tell you, the work from home and work from office option will be based upon your interview only. If you give a confident answers, even if it is wrong, also if you give a confident answers, and if you give a knowledge, like, trust to them that I have a knowledge on this, I can give my best. Okay, I can do my best and I can give the quality, then they will should hire you a definitely work from home option. Okay, no worries about that.
Okay, okay. Thank you.
Yeah. Any more questions? See, guys, I don't want to promise you that I'll give 100% placement, that we are not giving it like that. But I'll tell you whatever the companies without any background, without any BGV, they are hiring means, I'll definitely let you know that companies as well, and you can go through it, and you can do it your job from your end. Okay. So if we have a contact, like, I do have a contact. If they are okay with that, you can go and join. But main thing is that you have to keep my name, um, you know, in a good way. So some of the person, Kitty has given your name, but she's not performing well. So I don't want to suggest those type of members. Okay, each and every member, each and every one needs an employment to take a bed on our table, right? So for that bread, we need to do our hard work. Okay, I don't want to suggest just like for the sake of we are doing. Um Simply the job means, for those people that referring candidates is not worked out, basically in home health. See, for HCC and any other cadres, back end support will be uh, easily will be applies, but for home health it wouldn't be possible. It is a daily basis target, you need to finish it off. Okay. And one more thing I need to tell. And once you enter into the production floor, once you cross the interview, once you cross the training session, once you enter into the production floor, there will be a tentative time period to reach your goal. Okay. First 1 week they will give with the one chat only. Okay. In either level 1, level 2, or level 3, whatever the level that have given to you. Okay, that will appoint to you. Okay. So based upon that, there will be a tentative time period to give a target. Okay, almost the 45 days will be there to reach your target level. If coding only means 18, coding only YSS means 11 to 12, and level 3 coding means up to 5 to 7. Okay, so 45 days is there to learn each and everything based upon the project level. And whatever the training that I have given to you, that is the basic coding, basic OASIS, basic POC. Okay, project level updates are very different. Okay, but for whatever the example that I have given to you, M1028, like that, direct questions will be there. Any project you could take. So that is the uh, basic and final thing, like that. Okay, based upon the functional activities only, that would be made differ in the project updates. Remaining part as it is will be there. You took whatever the project is. And again, I'm telling you, based upon the experience only, you need to learn this home health. Cross training only not helps you to get a good amount in your organizations. Okay, first you need to start. And firstly, in your mind, you need experience. You want experience in the home health. Okay, don't expect too much. A simple tip I'll tell you: if you have 6 months to 1 year of experience in home health, after that you can keep, like I do have 3 to 4 years of experience, and you can, right nowadays it is doing like manipulating the pay slips, manipulating the experiences and all. That will works out for some companies. Omega BGV will be there for sometimes if candidate was not giving properly, not giving quality. Okay, they will do BGV after enter into the production of floor. Okay, they won't do BGV prior onwards. And gets like company, they will do BGV from college level. Okay, and like the startup companies, Clinicon and whatever the Mega Genesis, Foresight and Solemnity, Gravita, and one more thing, company is there. I forgot that name. Yeah, Red Road also will have a BGV. Okay, prior your appointment only, they will have BGV. So you have to choose some companies which are not having a BGV at that level. Okay, this is what I'll tell you. But once you enter into the home health, it is a booming project that you could earn more enough. Okay.
Kirti, one more thing.
Yes.
After the cross training, uh, I have seen some of the companies are asking for the certification. After I do my cross training, if even after when I'm doing a home health coding also, in certain point of time when I feel that okay, I need to do the certification also for further growth, then I can do the certification anytime. I have to do the training again, or I can directly apply for the certification.
Yeah. See, Sushma, for home health, no need of again training and all. Okay. For the BCHHC in Omega only, they will give training for 1 or 2 days. It is more than enough. Okay. So, if you want CPC level of certification, CPC, CIC, CCS level of certifications, you need to do the training, because for CPC level, we have ICD-10 and HICPICS, CPT level codes, and another one more subject is that. So for that, no one company will provide, no? But Omega will provide your certification amount, but they will take a bond, I think around 2 years.
I think 2 years, yes.
Yes. So, to avoid that bond level agreements, you can do better outer side. Okay. These AAPC AHIMA levels. OASIS you can do from your end only, Sushma. That is not a big matter. Okay.
Okay. And after certification, is there renewal thing like we
Um,
do in CPC certification?
yes, exactly. For BCHHC, we do have after 5 years of renewal. So if you're doing in the same company, it is not like a renewal. You need to again redo the exam.
Examination. Okay. Okay.
not like CPC, CIC levels. So for BCHS, COS, HCS, COKS, it's a top-notch level of OASIS examinations. So for the entry-level people, BCHC is enough. Okay. So
Okay.
I want to research on these three examinations, because who are in the top notch level and who are running the institutions or who are running the organizations, they will require these type of certifications. For just the employees, no need of these certifications. If you want, you can research on that and you can do that. But all four, the first four certifications are related to the OASIS, and it is not going to provide by the AAPC AHIMA. That is completely related to the home health
Home
department.
health.
It's
Yes.
completely different. Okay.
Yeah.
So these are Board of Medical Specialty, Coding and Compliance, and this is for OASIS, and this is for AHCC. All are related to the home health only.
Okay. Thank you, Kit.
Yeah, no. So if you want a complete OASIS training means, then I think it won't much. Only for OASIS training or won't much level of training and all. Once you hands on the experience, you will get to know how the examination it will be. You have so many videos in YouTube and also in Instagram. Also, they are giving us so much of information on this certification. You can go through it. Okay, but in AAPC, AHIMA, this information won't be available. Anyone else?
And Kirti, after the training, how many months it will take to get the job? You have any idea?
See, Leelavati, it's not like, home health is not like a 6 months project like seasonal projects. Once the project get into the hands, it will last up to 4 years, 5 years, 12 years. We doesn't know. So we are not having the idea when the organization will recruit the members in a bulk amount. And nowadays they are hiring experienced candidates who are much more hands-on with a number of platforms. So that's why I told you, you have to know at least three basic and which are important EMRs. I maybe if you have a good luck, you can get after the training itself, you'll get a job within a week or within a month. So it's not having a time period. Okay. For HCC, I could able to tell you like, so it's a seasonal project for 6 months, it will work on, and another 6 months it won't work on. For that, we do have a certain time period when goes to the recruitment. But home health, sometimes based upon the clients, they will do a bulk recruitment. So at that time, I'll let you know for sure. You can get into that. So they will ask you what you will do, what you are doing in the career time gap. So you have to tell that I did freelancing. So what are the projects that you did means you need to do. I don't want to disclosure my project names, but I do have experience on this platform. Okay. So any organization doesn't ask agency project related things. You can give project related guidelines, but that project name shouldn't be disclosed. Okay. Omega like companies, they will ask you what are the projects that you did. You have to tell I did so many projects, but I did projects on this EMR. If you want, I could let you know whatever the things that I did in the EMR, but I don't want to disclosure my project names based upon my company guidelines. Okay. I'll tell you all the project guidelines, project updates and all, but don't disclose any of the project names. That is highly confidential. Okay. Still they are asking means, no, you can tell. Okay, then I'll tell you one or two agency or two projects that I worked on. Okay. See, number of agencies, number of projects will be there around, I think, me only added around 200 to 300 projects in home health with the same platform. Okay. So So projects are very huge in number. Platforms are very low in number. Based upon the platforms only, you need to go. Okay. Projects, all projects are with different guidelines, but it is very easy and very quite challenging and quite interesting also. That's what I would say. Don't fear about that project numbers. Omega like companies will help us number of projects directly from the client end. So based upon that, I'm telling you. Okay. So you need to be hands on the platforms, EMR, electronic medical records or health records. Any more else?
No, nothing else, Kitty. Thank you.
Thank you. Thank you, Lilavati. I think
Okay,
only
Kirti,
Sushma
thank you
Lee
for
was.
the wonderful session.
Thank you.
So
Thank you.
okay, we are planning to start the batch from next week onwards. So if you are interested, please connect through WhatsApp and also please share your feedback on the session. Okay, let us wind up the session. Like Kirti.
Yeah, sure. Thank you,
Okay,
Fazana.
once again, thank you all. Thank you all for
Thank you.
Thank you,
session.
Kirti. Thank you.
Thank you so much.